Good afternoon, everyone, and welcome to COSSA Headlines, our monthly look at what's new and noteworthy in social science policy. I'm Wendy Noss, COSSA's Executive Director, and we are very fortunate to have with us today two guests who will join us in just a little bit to talk about the psychology of COVID-19. But first, what we'd like to do is to go over some of the top headlines of what's new in Washington and the policymaking world as it relates to social and behavioral science. So, as a reminder for folks who have joined before, or if this is your first time, Ring Central operates a lot like Zoom. So you can use the chat function at any time to ask any questions about our headlines topics or to pose questions to our outside speaker today. And we will open up the lines later on so you can have a more direct conversation with our speakers as well. So without further ado, let's dive into this month's headlines. First, in Congress, last month, as many of you know, the House passed 10 of its 12 annual appropriations bills, including those that are of most interest to the scientific research community. Of course, the outlook for the final FY 2021 spending bills is still very much up in the air as lawmakers continue to grapple with pandemic relief negotiations as well as the November elections. The House bills, which were written by Democrats, include several funding and policy provisions that will be non-starters for the Republican-controlled Senate. For example, one area of contention between the parties is whether to use the 2021 appropriations bills to provide additional coronavirus relief, as is done in the House bills, versus negotiating separate measures, as we've seen over the last several weeks, for addressing ongoing coronavirus relief. Complicating things further, of course, are budget caps that were put in place last year. As we've previously reported, bipartisan budget agreement was passed about a year ago, providing much needed relief to tight budget caps on discretionary spending for 2021 and 2020, the year we're just starting to close out now. The deal allowed Congress to increase funding to federal agencies across the 2020 appropriations bills, but for next year, 2021, the deal raised the caps by only 0.4%, setting this year up to be a really difficult one in terms of annual appropriations. Despite the caps, though, the House bills do include fairly healthy budgets for the science agencies that we care about. But timing, of course, as I said earlier, for final 2020 spending is really up in the air as the Senate has yet to take up its version of the bills, leaving many of us to expect a continuing resolution to be the course of action when Congress returns after Labor Day. You can find all of the numbers for the agencies that we care about found in the House legislation on our policy webpage, and we will update that as we move through this 2021 process. But of course, on COVID, congressional leaders continue to negotiate with the White House, which could be the final COVID relief bill, certainly before the November elections. But we do feel that negotiations may be stalled, possibly until September. So we will all be waiting to see what happens there. And if any ground can be made in reconciling the differences between the very different the HEROES Act that passed the House back in May and the HEALS Act, which has been introduced in the Senate. So stay tuned for more information there. Also related to the COVID relief package, the Senate has incorporated a bill called the Safeguarding American Innovation Act into its HEALS Act, its coronavirus package. The bill, which is sponsored by Senators Portman, a Republican, and Carper, a Democrat, is sweeping legislation that aims to tighten the security of the U.S. research enterprise against competing governments, most notably China, by imposing restrictions on collaborating with foreign entities. Of course, as you might expect, the bill has been criticized by many in the research community for being too restrictive and for potentially discouraging foreign scientists from working in the United States. Some of the controversial pieces of the legislation include expanding the authority of the US State Department to reject visa applications from anyone seen as tied to a hostile foreign government, imposing criminal penalties, including jail time, for scientists who fail to disclose ties to a foreign government, and establishing a new research security oversight body within the White House Office of Management and Budget. We are really closely monitoring the bill and whether it'll be included in future coronavirus packages. We and a lot of our partners, as well as lawmakers in the House and Senate, have been weighing in with several concerns about this legislation. So we will keep you posted as we work to eliminate some of these provisions or the legislation altogether from the next coronavirus package. Okay, in other news, the House and Senate have begun negotiations on the annual authorizing legislation for the Department of Defense, known as the National Defense Authorization Act. This is not commonly a bill that COSSA follows too closely, but this year there was a challenge to social science research at DoD. The administration was seeking to eliminate funding specifically for the Minerva Research Initiative, which is university-based research grants for basic social behavioral science related to national security. Thanks to the advocacy of a lot of our partners working together, we have been able to secure language in the House and the Senate bills that would restore funding and actually increase it a little bit for the Minerva Initiative in fiscal year 2021. So we believe that as we head into final negotiations on the defense authorizing bill, we're in a very good position to again see support for Minerva in next fiscal year. So a big win there for our community. Okay, turning to executive branch news. It's no surprise to this community, I'm sure, but the Census Bureau has announced that it will cut short its counting operations for the 2020 census by a full month in order to produce apportionment counts by its legally mandated deadline of December 31st of this year. According to the announcement, the Census Bureau will end field data and self-response collection on September 30th rather than October 31st as previously planned. This change comes months after the Census Bureau itself asked Congress to delay the deadline for producing apportionment counts in order to allow more time to recover from the delays caused by COVID-19. And while the House's most recent COVID bill, that I mentioned earlier, would delay this deadline to give the Census Bureau more time, the Senate bill does not. So although the change appears to really be prompted by Congress's failure to adjust the apportionment deadline, many census stakeholders see it as a part of a broader attempt by the Trump administration to undermine efforts to produce a full and accurate count, particularly of immigrant, undocumented, and minority communities. They obviously point to the protracted battle over the failed attempt to add a citizenship question to the census, as well as President Trump's more recent, likely unconstitutional order to exclude unauthorized immigrants from apportionment counts. As immigrant and minority communities are among the hardest to count populations, a truncated enumeration period would likely result in an undercount of these groups in the final count. So COSSA, our partners, and lawmakers on the Hill are all working together to see if we can address this deadline and make sure that we have the most accurate count as possible. In more COVID agency related news, last month, HHS released new guidance that instructed hospitals to bypass the CDC in reporting COVID-19 data and instead sending information directly to HHS through a relatively new system called HHS Protect. The change has raised concerns among many public health and science stakeholder groups that it could signal an effort to sideline the CDC in responding to the pandemic and to limit the data available to the public. Prior to this change, hospitals submitted COVID-19 information to CDC's National Healthcare Safety Network, which released the data on hospital capacity and staffing, but is now no longer being updated. While some reporting indicates that HHS officials intend to make data collected by the new system publicly available at some point, no concrete plans to do so have been announced. COSSA joined with about 100 other stakeholder organizations on a letter to the White House Coronavirus Task Force, calling for the administration to reverse this decision and commit to ensuring that COVID-19 data remains publicly available. And we will continue to keep the pressure on to make sure that those data are made available. Okay, over at NIH, on June 13th, NIH released an agency-wide strategic plan specifically on how NIH intends to direct research in response to the COVID-19 pandemic. The plan is intended to provide a framework of new research programs and repurposing of existing programs that would assist in mobilizing the research community in developing treatments, prevention methods, and vaccines. And I know the research community is very interested across lots of agencies about how the grant-making process will be changing, how research priorities will be shifting given the pandemic. So you can take a look at NIH's plan on their website. We provide a link there on your screen. Okay, turning to some community news. The American Association for the Advancement of Science, or AAAS, has released the first of 3 planned draft plans that are intended to address the issue of systemic racism in the sciences. The first report is called Holding Up a Mirror, Demographic Representation in AAAS Functions That Advance Careers. The plan outlines AAAS's commitment and proposed actions to embed diversity, equity, and inclusion within its operations. Other forthcoming draft plans will focus on AAAS programs and initiatives to increase diversity, equity, and inclusion in science, as well as AAAS actions to ensure diversity, equity, and inclusion within AAAS itself as an organization. And these other reports are expected to be released sometime in September. The National Academies Societal Experts Action Network, or SEAN, which we covered in last month's Headlines Deep Dive, has released a new rapid expert consultation called Encouraging Adoption of Protective Behaviors to Mitigate the Spread of COVID-19. The guidance draws on research from communication, social psychology, and behavioral economics, as well as lessons learned from successful public health campaigns such as tobacco prevention and seatbelt use. It offers a set of strategies to make adoption of preventive behaviors more likely, as well as risk communication strategies. It's available both in sort of a detailed report as well as a shorter infographic on the National Academy's website. The Academies has also launched a fast-track study to develop a framework for planning the equitable distribution of vaccines against COVID-19. The study is sponsored by NIH and CDC and is responsible for producing a consensus report considering several questions, such as what criteria should be used in setting priorities for equitable allocation of vaccine, or how should the criteria be applied in determining the first tier of vaccine recipients, or for the US, how can communities of color be assured access to vaccination, as well as lots of other questions that have been posed to this committee. There was an open session of the first meeting on July 27th, and it was announced that the committee is planning to produce a discussion draft and release it for public comment by early September, hold a public workshop to collect additional feedback, and then issue its final recommendations by October. And finally, we like to end our update with things that are going on in the COSSA community. We are looking for nominations for one at-large seat on our board of directors. The board is the policymaking arm of COSSA and guides the actions of the organization. And we have 3 at-large seats, one coming up for the 2021 to 2023 term. We are looking for folks who might be social science researchers or researchers whose work spans disciplinary boundaries, maybe university administrators, professional association leaders, private sector folks, foundation representatives, or anyone else who might offer a unique perspective to COSSA and our governance. The deadline for submitting nominations is tomorrow, August 14th. And you can simply email me if you have any questions or submit your nominations directly to me in my email address, which you will get at the end of today's presentation. And finally, hopefully you are receiving COSSA's Why Social Science monthly blog. This most recent edition was prepared by Ken Pruitt, who is president of the American Academy of Political and Social Science and Carnegie Professor of Public Affairs at Columbia University. And his piece argues that the social sciences can better incorporate ethical frameworks in order to end structural racism. It's a very provocative piece, and it really will make you think about the social science enterprise writ large and how we are able to address racism and inequality. So I encourage you to check that out at whysocialscience.com. I'll pause for 1 second to check the chat box. I don't see any questions, but if you have any or want more information, you can go to our website. All of these topics and more are covered in our monthly COSSA Washington, or our bi-weekly COSSA Washington update, which we're taking a little break from in August, but we will be back in early September. So reach out if you have any questions about anything here. But without further ado, I think most of you are here to hear from our guest speakers. And so I will pass things over now to Howard Kurtzman from the American Psychological Association, who is also a member of the COSSA Board of Directors. And we're really happy that he has agreed to help moderate today's discussion. Howard?
Thanks, Wendy. Can you hear me?
Yes, thank you.
Great. I'm Howard Kurtzman, Deputy Chief Scientific Officer at the American Psychological Association, and I'm pleased to introduce Stephen Reicher of the University of St. Andrews in Scotland, where he is the Ward Law Professor in the School of Psychology and Neuroscience. Much of Dr. Reicher's research addresses human behavior in crowds and in crisis situations. This year, he has advised the governments of Scotland and the United Kingdom on their responses to the COVID-19 pandemic. He is also a contributor to and the co-editor of a new book titled Together Apart, The Psychology of COVID-19, with fellow social psychologists Jolanda Jetton, S. Alexander Haslam, and Tegan Cruz. It is an ebook free for download from Sage Publications. Welcome, Stephen. It's great to meet you. We'll start with you providing a brief overview of your book, and then we'll have some time for questions and answers. Viewers can submit questions through the chat function.
Okay, well, thanks very much, Howard. And thank you very much indeed for inviting me. It really is a pleasure and a privilege to talk to you today. It always seems a bit strange talking to a large number of people who I can't see, sitting in my study in Scotland, which, being Scottish, is at the moment cloudy and cold and a typical Scottish summer. But I hope the rest of the evening won't be quite as gloomy. As Howard said, I'm a social psychologist. I have spent my career working on group processes, how people behave in groups, processes of social identity, and so on. I've never been particularly involved in policy, except insofar as some of my work has been on how people behave in emergencies and disasters. And through that, I became involved in what is called SPI-B, which is the behavioural science group advising the UK government, and also the advisory group to the Scottish government. And it's an interesting contrast, because what's happening in England and Scotland is rather different. It's not that different from the contrast between what's happening in the US and Canada. And so it gives an interesting comparable perspective, comparative perspective, I should say. So what I'm going to do today is to, in a sense, try and bridge between the theoretical work that we've done on group processes and social identity processes and its implications for the behavioral science of a pandemic. And in a sense, I'm going to talk about some lessons for dealing with a pandemic. And it is indeed based on the book which Yolanda and Alex and Tegan and I wrote very quickly. We spent about a month or so not seeing our families, writing till late at night in order to produce this. Can we go to the next slide? Because in many ways, I could summarize the message very briefly in this quote, which a number of you will recognize. It comes from Andrew Cuomo, the governor of New York. When at one point, fairly early in the pandemic, when people were talking about not wanting to obey restrictions and what they wanted to do and what their preferences were, he said, Cuomo said, we started saying, it's not about me, it's about we. Get your head around the we concept. And what I'm going to try and talk about in many ways is the psychology of the we concept to help us get our heads around this concept and what its implications are. So again, next slide, please. If you look at the traditional psychology of how people behave in disasters and emergencies, it rests on a very widespread notion of human psychology, of the human subject, whereby the core assumption is that human beings are effectively rather cognitively fragile. We have a weak grasp on reality. We are subject to all sorts of biases. We are unable to deal with complex information. We're unable to deal with uncertainty, with probability, and particularly when we're placed under stress in a crisis, and when we are together, then that fragility leads to us cracking. We lose our ability to think rationally and we panic. And so we behave in ways that actually make the crisis worse. This is an idea which is not only very widespread in academia, in psychology, it's also very widespread, of course, in popular culture and in government. You won't have a Hollywood disaster film without people fleeing from some danger, waving their hands in the air, blocking up the exits, and so turning a crisis into a tragedy. And equally, in the work that I've done with the UK government, mainly about behavioural emergencies, the assumption very often is, look, if we tell people too much, if we give them information, won't they panic? Don't we have to, in a sense, shepherd them? Don't we have to act in a paternalistic way in order to make sure that we don't lead to this catastrophic crack whereby psychological fragility gives way to panic? Now, the interesting thing is that when you study crises and emergencies, you don't see anything at all like the Hollywood representation. You don't see people trampling over others to get to the exits. You don't see people pursuing their own interests blindly in ways that leads to tragedy. What you tend to find is that people support each other. People stay with each other. People are calm and they act purposefully. Very often, if they die, it's not because of a psychological problem. It's often because not enough information is given to them to understand the nature of the danger, and by the time they try to get out, it's too late. In other words, the presumption of fragility, which leads to the restriction of information, is more the problem than any fragility itself. So what does actually go on? Again and again, in a number of studies in a number of countries, you begin to find that not only do you get this support amongst people, and this support extends broadly. It's not only to your family, it's not only to your friends and to your acquaintance. People support strangers. And many of us have that experience, for instance, in a hard winter when it snows and we're all facing the same hard times. You begin to talk to people you've never talked to before. You begin to become acquainted with neighbors you didn't know before. And putting it slightly more technically, what goes on is that in a condition of shared fate, you begin to get the emergence of a sense of shared identity. people indeed begin to think not in terms of I, they don't focus their identity on what makes them unique as an individual. They begin to think in terms of we, in terms of a social identity. They extend their identity, if you like, to the extent that others become part of that same we. They cease to be other. And there is a whole range of research looking at the implications of that. When you get shared social identity, when people share a category membership, either one which is long-standing, being a member of a football club, of a religion, of a political party, or whether it's an emergent one, as in a disaster, you begin to see cooperation, you begin to see trust, you begin to see support, and you begin to see help. And in many ways, that when people have a sense of being part of a collective, when they have a sense that others are not an impediment and indeed are not other, but rather are part of the extended we and are likely to support and help them, that leads to a sense of effectiveness, of empowerment, of resilience. So resilience is not something within the individual, it's an emergent property of shared fate in a crisis, leading to shared identity, leading to presumptions that I can call on others to help me through a particular crisis. In many ways, that shared identity, that we-ness, that we concept, as Cuomo put it, is the most precious resource you have in a disaster. But it's fragile. It can't be taken for granted. It can easily be ruptured. Bonnie Henry, who was the chief medical officer in British Columbia and apparently a little bit of a hero in Canada, put it rather nicely. Lots of people say, look, we're all in the same boat in a pandemic. She says, we're all in the same storm. We're not necessarily in the same boat. Some have a far more robust vessel, and others are very much at the mercy of the elements. And unless you can scaffold that sense of shared identity and shared experience in practical ways, it's very possible for the community to fragment. And so, for instance, in the UK, one of the things that was critical for the formation of shared identity and very widespread adherence to lockdown was not simply the original emergent identity, and not simply a rhetoric of togetherness. It was practical things like a furlough scheme, which meant that if people couldn't work, they could still get paid. Or if you were self-employed, you got income. That's now going away, and now we're beginning to see divisions. But there has to be, if you like, a practical scaffolding, as well as a, if you like, rhetorical support for shared identity for it to endure. And in many cases, administrations who divide people in their practices can undermine that sense of shared identity. So it can't be taken for granted. I just want to talk for a few minutes about what its implications are. And the first and the most important implication, I think, is the point about adherence to pandemic restrictions. You see, if you're a young person, I have a 16-year-old in the next room as we speak, and you thought about things in terms of personal identity and personal interest, you might say to yourself, well, if I'm young, I'm unlikely to get infected. So my risks, my costs are low. On the other hand, staying in is something I don't want to do at all. I want to go out. I want to see my friends. I want to party. And so the costs of staying in are very high. You might come to the conclusion, the cost-benefit analysis says to you, on the basis of personal costs, personal benefits, I'll go out. And if you did that, and if all people went out, you would, of course, have high levels of transmission. But that didn't happen. Because actually, and there was survey research done certainly in the UK, and I suspect in other places as well, which showed high levels of compliance because people were thinking in terms of collective identity. Because if you think of interests, that the self of self-interest is the we rather than the I, then the cost of going out is potentially to kill vulnerable members of the community. And so the cost-benefit analysis at that point turns around considerably and tells you to stay in. So the nature of the self and the nature of we-ness, and if you like, the self of self-interest, alters the calculation to a point where you get very different behaviors. And so in Britain, and I apologize, I will give you mainly British data because that's what I know most about, the evidence showed about 90% of people were abiding by lockdown. Of those, about 45% were genuinely suffering. They were genuinely finding it very difficult indeed, either psychologically or materially. And yet they continued to comply, and they complied precisely because they talked in terms of the community and the gains to the community. So that sense of shared identity is a crucial resource, but it didn't only lead people individually to comply, it led people to helping each other. Again, in the UK, we had over 4,000 mutual aid groups spring up and down the country, involving at least 4 million people. That's just the tip of the iceberg. Almost every street had its own WhatsApp group, Facebook group to support each other. And again, the basis for this mutual aid was a sense of shared community identity. And in a large-scale pandemic, actually, one of the things you discover is the state and state employees can't look after us. There aren't enough of them. There aren't enough police officers. There aren't enough firemen. There aren't firefighters. There aren't enough care workers. You need people to look after each other, to help those who have to isolate, to deliver food, and so on. So again, in this second way, the nature of shared identity was absolutely central to a positive pandemic response. And one further benefit, people talked about social distancing, and it's a pity that term took root, because actually what we wanted people to do was to physically distance, because physical proximity could kill through the transmission of the infection. But at the same time, we didn't want people to be socially distanced and socially isolated from each other, because there is an increasing body of research looking at the relationship between group processes and both mental and physical health, which shows that groups are good for your health. That being in a group and believing that others are going to support you is critical, both in terms of mental well-being. It's a strong prophylactic against depression, and also it can be a strong prophylactic against things like heart disease. So we want people and we need people to feel part of a group, to feel they can call on others, because it defends their mental and it defends their physical well-being. And that's why we call the book Together Apart. People have to be physically apart. We want them to be psychologically together and feeling part of groups, and knowing there are mutual aid groups and knowing there are others out for you. Absolutely critical for getting people through this pandemic with the minimal damage. Now, I just want to finish by sounding some notes of caution, because in many ways, I think of group processes a little bit like dynamite, that groups are immensely powerful. If people act together as part of a common category, that gives them real power to enact their view of the world. It is through social identities that people are agentic and people can shape their world. But just like dynamite, that power can be used in constructive ways, and we see that during the pandemic, but of course it can be used in profoundly negative ways as well. The power of the group can lead to exclusion and racism. The power of the group can lead to us fighting racism through the civil rights movement, through the Black Lives Matter movement, and so on. So the ways in which groups are created and construed is absolutely critical. Now, leadership at this point becomes absolutely at the core. If you look, for instance, at the divisions there have been in your country over issues like mask wearing and so on, and you compare them with other countries where there is no partisanship around mask wearing. So if you look at the UK, for instance, not everybody is in favor of masks. There are people against it, but it does not map onto whether you're Conservative or Labour in the same way it maps on to whether you're Republican or Democrat in the United States. And that's because masks in and of themselves are not polarizing. It is turning them into symbols of political identity and, if you like, melding them with particular political ideologies, which can lead to that polarization. And leadership is central to that. A leadership which tells you that masks go against your Second Amendment rights, is very different from a leadership which says the point of masks is just that we're showing respect for each other and trying not to harm each other as a unified community. So the ways in which leaders act in order to create or divide social categories is absolutely critical to the question of whether we have a unified community in which people sustain each other, or a divided community in which people see certain people as other or even as causes of the pandemic. And when that happens, then the positivity of group processes can turn to the toxicity of group processes. And we've always seen this historically. Pandemics are not always good news stories in terms of social cohesion. In fact, if you go back to the Black Death, you see it was at the root of anti-Semitism in the Middle Ages. In Strasbourg in 1349, on St. Valentine's Day, 2,000 Jewish people were burnt to death because they were identified, they were scapegoated as the other who was causing disease. So leadership is absolutely critical. And what's more, if you have division, even without scapegoating, if you have a division whereby certain groups feel that we're not in the same boat together, we're told to lock down, but we can't afford to do so. We can't put food on the table and lock down, and therefore they resent those restrictions as illegitimate. And if when they break lockdown, they're met with repression by policing, that can be a recipe for social disorder. And again, we've seen that in a number of countries, and I think that's part of what's been going on in the United States. So I'm not being, if you like, Pollyanna-ish. I'm trying to say to you, groups are always good. I'm saying groups are really powerful. And if you understand the we concept, and if you understand how to create and to sustain inclusive groups, it can be an asset rather than something negative. But I just want to finish with something really powerful and important, I think, in terms of the core notion of the human subject, which is the heart of my discipline, the discipline of psychology. And again, I go back to this contrast between the fragility view and the collective resilience view, because it does seem to me that many politicians, certainly in the UK, at the UK level, Boris Johnson, for instance, has started from the premise that the public are a problem that has to be managed. The public are unable to cope with difficult and negative knowledge, and therefore we have to shield them from the reality of what's going on. We have to ply them with relentless good news stories, that we cannot be transparent about information, and that we cannot admit to any weaknesses or any mistakes. And the problem about that point of view, again, and it goes back to a lot of research that's done on why people obey authority and about procedural justice, is it positions the public as the other. It positions the public as an outgroup. And if authority positions the people it is trying to influence in a paternalistic way as an outgroup, it's going to lose influence over them. To me, one of the key stories in this pandemic is not efficient leadership and supine populations, at least in the US and the UK. It's very much the other way around. It is the self-organization of publics who have acted quite heroically, who have gone along with huge restrictions even when it's very difficult for them, and they've done it for the common good. So it does seem to me that the evidence shows us that actually the public, united with shared identity in a unified group, is, as I was saying at the beginning, the most powerful asset you have in a pandemic. And rather than distrusting the people and seeing them as the problem, you should see them as an asset, know how to use and to, if you like, shape that asset. And that's the best way to get through a pandemic. And I'll stop at that point. I'm sorry for going on too long. Sorry, that's the end. I've gone through, sorry, I went too fast. I've gone right to the end now. So I finished with trust the people. Sorry about that.
Okay. Thank you very much. That was fascinating and very thought-provoking. We have a question in the comments. I will read it out loud. I recently heard a commentator assess the quarantine period in the US as having reached its maximum limit by any reasonable measure, and that it was time to open up institutions. I disagree with that assessment profoundly because I think we underestimate our capacity for hardship. If we are able to nurture a sense of community in times of need, I'd like to hear your thoughts on the maximum extent of hardship we can bear.
I think that's a brilliant question. So thank you very much, whoever asked it, because it goes to the core of a huge controversy, which have huge implications actually for psychology and the behavioral science. Because in the UK, early on, there began to be talk of behavioral fatigue, that people being fragile can only deal with lockdown for so long, so we have to delay lockdown. And many people will argue that one of the reasons why Britain did so badly is we delayed lockdown. It could have cost 20 to 40,000 lives. So people were beginning to say, well, look, the behavioral science has in effect killed 40,000 people, which is not a very nice position to be in and not very good for our disciplines. And it gradually emerged that this argument did not come from the behavioral scientists. So certainly those of us sitting on the advisory groups not only didn't say this, but we argued strongly against it. But I think it's important to make a distinction. So compliance can fall. So if you're talking in terms just purely descriptively, does compliance sometimes fall over the long term, then it can. But the question is why? Right? And there are three, those who work on behavior change will talk about three factors. One of those factors is information, letting people know there's a real danger out there and you need to do something about it. And if you don't explain to people there's a real danger out there, they're going to be asking themselves, well, why should we put up with hardship if there's no reason for it? The second is practicality. It's all very well to say to people, lock down, but if you don't give them the material support to do so, it's simply impossible to do so. So in the UK, for instance, and there was similar data in the US, it showed that between 3 and 6 times as many poor people broke lockdown as rich people, but their motivation was the same. It wasn't an issue of motivation, it wasn't an issue of wanting to, it was an issue of support. When it comes to motivation, I don't think that's where the problem lies. And in suggesting the problem lies with psychological fragility, what you're doing is blaming the failures of government in terms of good information and good support on the psychology of the people. Because I do think that people can put up with hardship. And I think actually in many ways people relish hardship. There are mundane examples of that. Ask any runner or any swimmer, and they will tell you about the burn, and they will talk to you about the pleasure of, if you like, overcoming that when they run a marathon, or they swim 100 meters, or they cycle, swim 10 kilometers, or if they cycle across America. And we've done quite a lot of work in India, and one of the biggest mass events in the world, the Kumbh Mela in northern India. And it's a fascinating event because elderly people go and live in very basic circumstance for a month by the Mela, and they get up and they bathe in the Ganges before dawn, and it's freezing, and they will talk about it as bliss, because in suffering they affirm their identity. It's a concept we've rather lost. It's a medieval concept, the concept of ordeal. But to the extent that by acting in a particular way we affirm our identity, we prove who we are, people can put up and they can even relish extreme hardship. So my argument would be people can indeed suffer for a cause. If it's a way of showing your commitment to your community, people can put up with very hard times for a substantial amount of time. But if you don't make clear that there is a cause through poor information, or if you simply make it practically impossible, that's where the problem lies. So just to sum that up, I think there are limits, but I don't think the limit is psychological. And by looking at it as a psychological weakness, we misunderstand the problem and therefore the solutions.
Thank you. So you've referred to how governments have responded in various ways to the pandemic. If you could make an overall assessment of how well governments have done, and I realize different governments have behaved differently, from a social and behavioral science point of view, what would your assessment be?
Well, as I said at the start, I sit on both the UK and the Scottish advisory groups, and there is a big contrast. Actually, not at the beginning. At the beginning, the Scottish government made the same mistakes as the UK government in terms of delaying lockdown. They made some appalling mistakes in terms of transferring people from hospitals into care homes. So 47% of the deaths in Scotland have been elderly people in care homes. However, in time, they changed. And in time, I think they changed precisely on the lines that I've been talking about. So one of the things that catastrophically undermined the standing of the British government, the UK government, which ironically has jurisdiction in England, was, some of you might have heard about this, the Cummings affair, where Boris Johnson's chief advisor broke lockdown and was condoned and supported by Boris Johnson. In a week, trust in the UK government fell by 21 points. I mean, the pollsters were saying they've never ever seen anything like it, precisely because what they had done was, rather than creating a sense of shared identity, they'd created a sense of us and them. One law for us, another for them. And I think that has catastrophically holed the UK response under the water. There are other factors as well, but I think they've done all sorts of things which have failed to create and sustain a sense of shared identity. They've also been very bad at information, and they've also, I think, opened up too quickly. Scotland has been very different. In Scotland, the First Minister, Nicola Sturgeon, talked about an adult conversation with the public. There has been openness, there has been recognition of mistakes. They have done many of the things which, if there are any procedural justice scholars in the audience, they would recognize as the ways of creating a sense of trust and creating a sense of shared identity. And I was just looking at the polling evidence today. Basically, if you look at the trust in the UK government, it stands at roughly minus 40 points in terms of the difference between those who approve and disapprove. If you look at it for Scotland, it's plus 60. It's a difference of 100 points between the two. So I think in many ways, there have been very different responses, which have either, if you like, gone with the grain or gone against the grain of the types of arguments I've been making. And I think that's very much reflected in terms of the outcomes and in terms of the numbers of deaths. In many ways, the social science and the social science factors probably correlate better with the numbers of dead and infected than any medical or virological factors.
So without getting partisan, would you say that any particular political ideology or political party is more likely to take an approach that understands shared identity and to be more successful in addressing the pandemic?
That's a really interesting question. And I mean, a number of people, for instance, have been arguing that particular types of populist or extreme nationalist approaches are counterproductive. It's a difficult one to argue because there are some populist countries that have actually been reasonably effective domestically. The real problem, of course, is that this is a global pandemic. We often talk about it as if the worst is over, but at a global level, it is still growing in a number of countries, in North Africa and in Asia. And while we might be able to contain it nationally, we'll only be able to, in a sense, eradicate it internationally, and that requires, of course, an international response. And therefore, to absent oneself from that international process, I think, is deeply problematic. To undermine the WHO, I think, is equally problematic. So I think at a domestic level, it is complex. I mean, certainly those divisive politicians who have used coronavirus in order to weaponize it against their opponents have done great damage. And I think the two obvious examples are India, where it has been used in order to, if you like, to weaponize the Hindu-Muslim divisions. And at some point, people were talking about corona jihadism, in order to attack the Muslim population. And I think in the United States, where it was very much weaponized. And I think the image, certainly from the outside, the image of a head of state attacking legislation to control the pandemic from an anti-state perspective was indeed bizarre and something I didn't think I would ever see.
So we only have a few minutes left. I wanted to ask you about your thoughts about how the behavioral and social science research community has responded to the pandemic. You brought together many authors in producing your book, very impressive effort. Do you have an assessment of the overall community, how it's done and what more it can do?
Well, there has been quite a debate in psychology, partly reflecting our own insecurities, the replication crisis and so on, which I'm sure you're well aware of, and some people saying, well, you know, we can't trust ourselves, so why should anybody else trust us? I think that was a rather purist position, which came from a lack of engagement in policy and seeing the level of the questions and the very simple perspectives that could be used, and perspectives which I think are very well rooted in the literature. So some of the things I've been talking about the power of framing things collectively, the use of social norms and reframing social norms. I think things like just one principle we keep on trying to inject, which is the principle of co-creation and co-production. No matter how good a policy is, if you impose it upon people, if it comes from the outside, they will never own it or adhere to it. And therefore, it's extremely important to involve people in the development of policy so that the process as well as the content is something which is inclusive and creates a common community. So for instance, in Scotland, and as I say, I think Scotland is more responsive than the UK, we are now working on new forms of co-creation to allow communal input into the development of policy. So I think we can do extremely well, and I think we have done extremely well, and I certainly think that, you know, many people have done remarkable amounts of work and have worked tirelessly for many months in order to make an input. I do think we need to be sanguine. I think it is absolutely central as scientists to do two things. The first is not to overstate our expertise. We might know more than nothing, but there is always uncertainty, and I think we have to calibrate that uncertainty. If we claim too much, then when things change, people absolutely reject us. And the second thing is absolute transparency and openness. In the same way that trusting governments depends upon that openness, so I think trust in scientists depends upon absolute openness about what we're doing. And I think those two factors are going to be absolutely central to the next really huge behavioral science question, which is this, and I make this point time and time again. Many debates, I think, miss the point. People have a debate around whether masks will stop the pandemic. Masks won't stop the pandemic. Wearing masks will. That's behavioral. And people say, when we get a vaccine, that will solve things. A vaccine will solve nothing. People getting vaccinated might, but whether people get vaccinated or not, whether they trust the vaccine or not, is going to be a critical question. For that, they've got to trust the government who asked them to take the vaccine, and the scientists who say it's safe. So unless we are sanguine about what we can and can't do, unless we are open and transparent with our evidence and don't say, trust us, we're scientists, we're going to have a real big problem in the future, and already it's brewing. So these issues are incredibly important, and indeed they're going to be matters of life and death.
Thank you. Let me ask Wendy if we have time for one more question. I have a note here that
yes, go ahead.
Yes, so if I could ask Carl Mayer to unmute himself, that's the note that I have.
Sure, thank you. Thanks very much, Doctor, for your time and going over all this. You've kind of answered what my question was about how to frame this to various stakeholders. in terms of co-creation and kind of framing it in terms of behavior and not the technology. Do you have any other specific thoughts on how we might frame the value of kind of a collective identity to various stakeholders? Because it's a perfectly simple and elegant idea that's really going to make or break us, I think. And how do we as social scientists work toward framing this question?
Yeah. I mean, I think one of the issues is the level at which we act. So, for instance, working in the various advisory groups, we wrote various papers which enshrined various psychological principles, such as co-creation and so on. But often the devil is in the detail and is actually working with, for instance, the communications teams or working with the policy makers. And I think there's a really interesting question about the level at which we interface, not with policy, but with practice. One of the most pleasurable experiences I had, for instance, was working with the Scottish communications team. And the Scottish communications are really interesting and really impressive in the way in which they embed principles of collective identity and principles of norms, both injunctive and descriptive norms. That's what we should do and what we do in their advertising, and talking at the micro level of the precise wording, the precise imagery, the way in which you need to draw upon cultural experience to understand, if you like, the culture of Scottishness. So it's all very well to talk about these things in the abstract, but to implement them, to see how they play out, number one, you've got to have that situated cultural knowledge, the general process plays out in particular cultural forms. And secondly, you've got to be involved at that micro level. And so, as I say, for many years, I'd watched the Scottish advertising and been immensely impressed by it. Actually being able to talk to them and be involved in the formation of the adverts was, I think I can say it was genuinely a thrilling experience. So I do think it raises real questions at the level at which we interface, not just with policy makers at the higher level, but actually getting out, getting the seat of our pants dirty, to use an old scientific, social scientific term, to actually get down to the nitty gritty.
Yeah, words matter.
They do.
Yeah.
Well, I wish we had a lot more time because these are fascinating and important ideas. But I want to thank you, Stephen Reicher, and I will turn it over now to Wendy Noss at COSSA.
Can I just say, I'm sorry to Karen, if anybody does have a question and would like to email me, I would be delighted to continue the conversation. So do feel free. It's very easy. Just Google my name and you'll find my email very easily.
Thanks.
Thank you so much. That's very generous of you, and no doubt you will be hearing from folks on the line. And as we circulate the video of your presentation today, I'm sure there'll be lots more interest. So thank you very much to you and to Howard for managing this discussion this afternoon. Thank you all for joining us, and we're thrilled to see so many of you return month after month for these very important discussions. On your screen, we like to end each month with some homework assignments. If you are interested in staying engaged in our activities over the next several weeks. Again, we're interested in any names, nominations you want to submit for the COSSA Board of Directors. To be part of the sort of inside of this group, you get to work with Howard Kurtzman more on the COSSA board as a member, at large. But there are also things that you can do to help keep our momentum going on funding. We have an action alert on our website that you can go and shoot off a quick letter to policymakers as they finish up, hopefully soon, the fiscal year 2021 appropriations bills, and make the case why our sciences excuse me, need to be funded at robust levels. And we're always interested in learning more about the research that you and your constituencies are doing, whether related to COVID-19 or policing and racial relations and inequality, or anything else. We have a portal on our website, COSSA.org/share-your-story, where you can just send us things that we could use when we communicate with policymakers about the value of the science. So please consider sharing those stories with us. Save the date, we'll be back September 10th We have not set our deep dive conversation topic yet. So if there is a topic that interests you, it doesn't have to be COVID related, but that's where we've been the last several months. Do send us your ideas for speakers and for topics. We recognize that not everybody can join us each month, but we do have the recordings available online. And here is a list of just some of the topics we've covered over the last year or year and a half. And if you weren't able to join, you can get the slides and the recording on the COSSA Headlines website. We hope you found this useful and that you will spread the word to others within your organization. You will talk to colleagues at other organizations who may not be COSSA members. This activity is brought to you as a COSSA member benefit. If you think others would benefit from membership, please, we do appreciate when you share that information with others, and stay engaged with us as much as you'd like. Here's my email address if you need help connecting with Dr. Reicher or Dr. Kurtzman, or if you want to submit a nomination for our board, you can reach me here. And unless there is anything else, we would like to thank you again, and please stay well, stay healthy, take care of each other, and we will talk to you next month. Take care. Bye-bye.